Virus that has a lot of people talking right now. We're talking about Zika, a virus often contracted through mosquito bites, in some cases causing severe birth defects and brain damage in babies. That's that video really that got a lot of people's attention, I think, and wanted to talk more about it. The first case then diagnosed here in Indiana, we just found out yesterday. Zika first became an issue in South America for these pregnant moms. It has since spread into the U.S., leading to travel restrictions and new discoveries about how it does spread. And that's why we brought Dr. Keith Banks. He's an infectious disease physician with Community Health Network, here to talk a little bit more about it. And so nice to see you. Thank you so much for joining us. When you first hear, okay, it's in Indiana, did you get more questions from people, or what are you telling them first of all?
Well, first of all, there's been one reported case in a person who had recently returned from an area where there's an outbreak. There's no reported cases of vector-borne or mosquito-borne here at this time.
So let's talk a little bit about what I said earlier. You see the video of these babies with brain damage, and obviously that's alarming, especially to young couples, maybe someone who's thinking about having a baby. How severe is that? And obviously this is happening in other countries, but we're still concerned about that too. What do you tell pregnant women, and what do you want anyone to know about? Should we be concerned?
Sure. Certainly there are valid concerns given what's going on in Brazil. What I tell people that if the CDC guidelines state that if you're pregnant or have thoughts of becoming pregnant, you should consider either postponing your visit, or if you're going to an area in which there is Zika, to take precautions in terms of trying to prevent mosquito bites.
Yeah, which is not always easy to do. Let's talk about symptoms. What are people seeing? Are they usually about the same, or are they different?
Sure. The vast majority of persons who contract Zika virus have very mild symptoms. They say about 80% may have mild to no symptoms whatsoever. Others, you can have fevers, muscle aches, joint aches, headaches, and conjunctivitis or reddening of the eyes.
What do you tell people that are going, okay, I'm going someplace over spring break that has an outbreak? What would you tell them?
I tell them to use a Environmental Protection Agency registered insect repellent. If you're going to be outside, use mosquito nets, stay in air conditioning areas. Just try to reduce your risks for mosquito bites as best you can.
Something else that really kind of surprised me is when I heard that there was a case of where this was sexually transmitted. I'm like, really? And is that pretty rare, or is that something that you think that we're going to see more of? Is that like, well, that's going to be, I think, pretty rare?
Sure. As it stands now, I think there's a single case in Texas where they think it may have been transmitted that way. I think the vast majority of risks for transmission will be through mosquito bites. I think that'll be a less common cause, although we're still looking at transmission and how that occurs.
Dr. Banks, thank you so much. I know it's early in the stage, we're trying to still kind of figure this all out. If you would like to learn more about the Zika case in Indiana, the virus in general, our website is where you can find more information, FOX59.com, right?